Hi everybody. I've done this over and over and over again, like 6 times. So we're gonna try again. Today we're going over ulcerative colitis. It is an inflammatory bowel disease. It causes inflammation and ulcers in the digestive tract. This is the inside lining of your large intestine and your rectum. This causes a lot of bleeding, a lot of pain, in a lot of patients, malnutrition, dehydration. So it can be very difficult for them to live their life in a normal way, and it can be very life-threatening. And there are like 4 different kinds. The first one is ulcerative proctitis. This is inflammation confined to your rectum and your anus. So really the only sign or symptom is going to be bleeding. So that's kind of the most mild one, I guess you could say. And then we move on to proctosigmoiditis, and this is from, as you see over here in my picture, your rectum to your sigmoid colon, so like the bottom part or the last part of your colon. And then so the symptoms with that would be bloody diarrhea, abdominal pain, and an inability to move the bowels despite the urge to do so. Left-sided colitis is inflammation that extends from the rectum through the sigmoid colon up to the descending colon. Signs and symptoms include bloody diarrhea, abdominal cramping and pain on the left side, and the urgency to defecate. And then pancolitis, this is the entire colon is usually affected in this one. Severe bloody diarrhea, significant weight loss, fatigue, significant pain in all of their abdomens. So that's a really difficult one. The exact cause is unknown, but we do know that it's autoimmune. So it's attacking itself. It's attacking the cells in the digestive tract. In a lot of cases, it's very commonly seen that people who have family members with this disease have it as well. They used to think that there would be foods that cause the development of this disease, and that's not true, but there are foods that we'll talk about later that aggravate it. The clinical manifestations, there are often periods of remission and exacerbation. Some patients with severe ulcerative colitis can have as many as 15 to 20 liquid stools a day containing mucus, blood, and pus, and so that sounds awful. And then, but patients with mild to moderate ulcerative colitis may have 2 to 5 stools per day with some blood present. So it's a very severe and not severe. So because of severe, there will be a major loss of all of your electrolytes, including like sodium, potassium, bicarbonate, and calcium. And we'll talk about complications related to that in the next slide. And the urge to defecate lessens as scarring of the tissue is produced. So that's really just, you're going to need to talk to your patients about, or not even talk to them, just listen to them about their fears of their body image and not being able to control themselves. Moving on to the complications, severe bleeding, a perforated colon, which would, you would need to have surgery intervention for that because there's a hole in your colon. Severe dehydration, osteoporosis due to long-term loss of calcium. So we know that women are already at higher risk of having